This is really important stuff you're doing. Both political parties are indicating their interior in more time than a single payer. And that is the only way we're going to get them. That's like Roosevelt. We're really fighting it. More than absolutely right. Straight up, we're all Catholics.
Problem solved.
Yeah.
Problem solved.
That's wrong, Kevin. Yes, it is. We gotta get AOC in there and get rid of Nancy. Yeah. Absolutely.
Oh, okay.
The whole system goes out.
Very, very.
Lately, the last 4 weeks, I've had internet outreach. Phone out. It just goes up and I just sit you on.
Go around and say hi. We decided to sit near the
I just want to make sure I'm going to see
That's a
the
bad idea.
Facebook Live broadcast. I did Facebook Live.
yeah, and we got a clear shot.
This is it? This is it. We're live and we're ready to go.
Yeah, I thought of that.
Susan, no.
Oh, dear.
Where's the camera? She's right here. Okay. And stand up in front of the hospital.
Yeah.
Are you a member of the student yet, or with that?
Hello, I just wanted to thank everyone for being here to learn about this important issue with us. I'm Kimmy Wright. I'm a volunteer with the Healthcare for All Northern Michigan, which includes activists in Chippewa, Mackinac, Sheboygan, and Emmett counties. Healthcare for All Northern Michigan is a recent launch by the Center for Change in Northern Michigan advocacy group. The group shares a common interest in affordable and accessible healthcare for all. That is why Center for Change decided to co-host this important speaker event along with Michigan for Single-Payer Healthcare. You will find more information about the Center for Change and Michigan Single-Payer Healthcare in our handouts. So they're across from the food and in front of us. There's lemonade, punch, water, along with some vegetables out there. Healthcare for All, Northern Michigan, primarily serves as a subgroup of Michigan for Single-Payer Healthcare, which advocates across the state and at a federal level. We already know that the current healthcare system is considered broken by an increasing number of Americans. Among our goals is to bring important information to our region about a single-payer system as a potential solution. We are proud tonight to have Dr. John Cavacece here to speak with us tonight. He has been a family physician practicing full-spectrum family medicine for nearly 3 decades. He is a Michigander. He graduated from Sheboygan High School before earning his medical degree from the Chicago College of Osteopathic Medicine in 1986. Dr. Cavacece did his residency at Carswell Air Force Base in Fort Worth, Texas. He then spent about 10 years there as both a staff physician and a faculty member before taking his present position with Michigan State in Grand Rapids at Mercy Health Physician Partners Family Medicine. Dr. Cavacece joined the faculty there in 1996. His interests are primarily in behavioral medicine, teaching the concepts of relationship-centered care to residents. He belongs to many professional organizations. He chairs the group on family, which is a part of a society for teachers of family medicine. He has also been a member of Physicians for National Health Program since 2002. He is here to talk with us today about how a national health plan will benefit you. Join me in giving a nice warm welcome to Dr. John Cavacece.
Well, like he said, I am a Michigander from Northern Michigan. I graduated in 1975 from Sheboygan High. I remember coming up to the Sioux to play basketball in the gym against Sioux High. I was on the basketball team, so I know Northern Michigan quite a bit. We love it up here. Vacation. I grew up by Mullet Lake, which is south of Sheboygan. So, so tonight I'm going to talk to you about a few things. But I gave this talk, this title, about 5 years ago. I've given a form of this talk about 75 times over the past 12 years. But I call it a moral imperative now because that's how physicians feel. Most physicians feel it is the right thing to do. And it's crazy that we haven't done something like this till now. And we should have done it a long time ago. I'm going to talk about some of the reasons why we didn't and where we are now. So let me just give you an analogy that I had a brainstorm about not too long ago. Imagine healthcare in America is an American-made car. It just doesn't perform for what you paid for it. Keep pouring money into it, but its performance gets worse. And after a while, it breaks down. But damn it, I want to keep my American car. That looks like that. That's kind of a So then imagine if you had chosen a model from Europe or Asia. It's a nice car, it doesn't have quite the luxuries of an American car. But it always runs. You get excellent gas mileage. Maintenance is easy, and it costs half of what you pay yearly for your American car. It performs great. But if you learn, you will never need to buy another car. Ever. Just pay for your maintenance on the car you have that is a fraction of what you paid for your American car in the past. So think about it. So my objectives tonight are going to help you understand the degree of dysfunction in the U.S. healthcare system, maybe 3 areas of concern in the healthcare system, why a single-payer government-sponsored healthcare system is valuable and the way to go, and also some other avenues to learn about single-payer and the magnitude of the forces that oppose change. So that's the biggest obstacle we have, those forces. So first we're going to talk about the first of the 3 parts of the healthcare system, cost, which is a big issue. This is statistics from about 5 years ago. Our national healthcare bill was $3.1 trillion, or 17.4% of gross domestic product. That's now over 18%. It's projected to be up to $5.5 trillion in another 5 years, or almost 20% of gross domestic product. Insurance companies spend 25 to 30% of their income on non-medical expenses. It has nothing to do with helping the patients. The profits, the administrative costs, marketing, and the complexity of them that I face every day that drives me close to being crazy. Medicare spends 3 to 6% on administrative costs. And we overspend on unnecessary tests. We do a lot of tests in medicine just because we can. Oh, I want an MRI. Oh, okay, let's get an MRI. You don't need an MRI. But I want an MRI. And your doctor came to give you an MRI. And it costs anywhere from $1,000 in one hospital to $3,000 in another hospital. There's no rhyme or reason to how much it costs for the same MRI. So that is one of the biggest reasons we overspend. We spend a lot of unnecessary money on healthcare. If you have questions, let me know. I'd like to kind of make a conversation if you can. I'm going to try not to go too fast. I'm going to try to describe and explain all the graphs I have in detail so you understand. So this is a graph that shows U.S. public spending per capita. Now, public spending isn't just the taxes we pay for Medicare and Medicaid, but for healthcare, for government employees, for the VA. It's also for tax subsidies to private insurance companies. That they get tax subsidies through the government to help them
administer healthcare for employers in this country. That started back in World War II. If you want to hear a story of why that is, we'll do that later if you want to hear more about that. So as you can see, that $6,500 that we spend on public money is all tax dollars. And as you can see, that's as much as any other country in the world spends totally on their healthcare. That $3.5 trillion or $1,000 per capita is what you pay for, private funds. But most funds comes out of your taxes already. That's paying for people on Medicaid, uninsured, Medicare patients. You're paying for it already. So you're already paying more than people in nations with national health insurance. So you're paying for it, but we're not getting the benefit. This is another new interesting slide. So this is how deductibles have gone up over the past 10 years. As you can see, this is the percentage of workers, single workers, how much their deductibles have gone up over percentage of workers that have deductibles over $1,000. 12 years ago, it was 10%. Now it's over 50%. I recently saw a patient of mine who's a mother of 5. I delivered all 5 of her kids. Her and her husband both had jobs. He works for UPS. Her daughter recently, 14-year-old daughter, is struggling with emotional issues and had some suicidal thoughts. So they took her to a psychiatric hospital in Grand Rapids. And the psychiatric hospital recommended she be inpatient. Well, the insurance company said, no, we don't want her to be inpatient. Well, as a mother, she chose to go with what the doctors said. Now, guess what the deductible is for their family is $7,000. $10,000 is their deductible. So they will basically have to pay everything for her hospitalization for those 7 days. That's just not right. That's just not right. She, in turn, has chosen to leave work to be at home with her 2 young children and her 2 struggling teenagers. So, and she is a brilliant woman who is very passionate about these causes as well. So she's helped me out. So this is a slide I've been showing for ever since I started doing this talk. Timeline from 1970 to 2015. That's the percentage in growth of numbers of physicians and administrators over that time. The red bar is administrators. Those are people that work very hard and do a good job, for sure, but they really don't add value to your healthcare. Their main job is to administer the money, to make sure billing is done right, to make sure that somebody doesn't get a test that they don't approve of, or to make sure if you're trying to give them a medicine that's not on the formulary, that they don't get it. You have to ask special permission down your knees and beg sometimes to get the medications. So that to me is a striking picture. That's administrators. Health industry profits for 2015, as you see, the ones that make the most are the insurers and the pharmaceutical companies. What pharmaceutical companies are doing now is really criminal, in my opinion. I had a patient who has severe COPD, and he has Medicaid, Medicare. He's disabled. He quit smoking, and he was recently hospitalized. And he's also had blood clots in his legs that could kill him if they didn't get on blood thinner. They started him on blood thinner in the hospital. That he came to me after he was in the hospital. I said, "Are you taking that medicine?" He said, "Yeah, but is there something cheaper?" I can't. This is $106 a month. I can't really afford that. And the thing that, what's that?
Only 106?
Yeah, only 106.
Yeah, I had a prescription and I have decent insurance, and it was my copay, and it was diabetic medicine. It was $500 or $450 a month. My copay.
Yeah,
for 30 days a month.
yeah, that shouldn't be. Anyway, he could be uncommitted, but this guy doesn't have the wherewithal or to get to see the lab every month to get his blood drawn. He's uncommitted. That's the blood thinner that you have to get your blood tested. With the newer ones, you don't have to. So the insurance companies know that everybody wants those newer ones, so they charge more. Now we'll switch from cost to access, which has been, even though the ACA came out and got almost half of the people that were uninsured insured. As of 2014, there were still 33 million Americans uninsured, and unfortunately, it's disproportionately weighted towards the poor and minorities. And then not only are uninsured, but we have 80 million underinsured in this country. 75% of all personal bankruptcies are due to medical bills. A lot of people don't understand that most people that go bankrupt from medical bills had insurance when they got sick. And it wasn't their fault they got sick. All these people that want to blame the people that don't take care of themselves, that's a very small portion of this problem. Most of it is hardworking people that get cancer, get in a car accident, fall and break their hip, and now they can't work. And then they go bankrupt because they can't pay for their bills. 75% of personal bankruptcies. We rank 54th in the world in fairness, just ahead of Rwanda. Guess who said that bottom line? Anybody remember? They can just go to the ER if they don't have a doctor. Wrong. No, it was way before him. It's actually GW that said that. Yeah. Well, but we know that that's not a very effective and efficient healthcare system, is to have people go to the emergency room. Because the emergency rooms are for people that need it, not for people that have a cold or have diabetes and need to get the medicine. This is the one big bugaboo for me and lots of physicians. One of the reasons you can't get in to see your doctor is because that's how much time you spend in the new, quote, new and improved electronic health record, which is all electronic now, right? It's supposed to improve efficiency, improve quality. It has done the opposite for efficiency. I used to see 20 to 22 patients in a day, which is not a lot, but as a family medicine doctor, that's probably average. Since we started having electronic health records, I see 60 times. I just can't do it. There's too many buttons to push to get through a patient encounter. And the electronic health records were devised. Why do you think they were designed the way they are? Anybody got an idea of what? Were they designed to help us take care of patients? No. They're designed to help billers to get the maximum out of the bill. And to do that, we have to make sure we check all the boxes. If we don't check the boxes, we get audited. They tell us, we didn't check this box. I kind of want to say, I can't say it. So this is a statistic that came out with 10 years ago, and they've updated it. Basically, for every million people that don't have health insurance, about 1,000 of them die every year as a direct result of them not having health insurance. Nobody wants to believe that, but that's 28,000 deaths in 2015. And that, they figured that out through, obviously, medical records, finding out what people delayed care because they didn't have insurance and what they died from. So, question.
We should take note that California and New York are the lowest percentages, and those are truly democratic states.
Yes. Right. Texas is, am I surprised that Texas is at the top?
Texas is at the top.
We also have
So,
age too, so.
I mentioned this before, but most of the medically bankrupt had insurance at the onset of their illness. 60% had insurance. One of the biggest issues in our country is even Nancy Pelosi, I wanted to slap her when she said, well, we wanted to let people keep the insurance they have. And if you really ask people if they like the insurance they have, you'd be hard pressed to find people that like insurance. We saw what happened to the copays over the past 12 years.
But Nancy Pelosi is saying that for the people who donate to the campaign, that is the corporate owners of the Medicare system. And That's what she's saying.
Yes.
Not for you, not-
Yeah, it's supposed, yeah, because as much as I hate to admit it, Democrats take money from health insurance too, the health industry as well.
just in case.
If you want me to hear you, I'm a little hard of hearing. You can see my hearing aids, so if you. So quality, this is the third leg of the stool of healthcare. And everybody knows that America has the best quality healthcare, right? Well, we actually rank behind most other developed countries in overall quality of healthcare. This statistic here, avoidable mortality by age 75. That's, we don't avoid people dying of things that if we were able to treat them for 20 or 30 years before they got turned 75, they'd live a lot longer than 75. So we're last of those countries, developed countries. Healthy life expectancy at age 60, we're last of 23 countries. And we're also last in infant mortality in most developed countries. The insurance industry basically provides incentives to avoid covering the sick. At the end of the day, insurance companies are corporations, and their number one goal is to make a profit. It is not to ensure that their members have good health. That's secondary. If that's a side effect of what we do, fine. But our number one goal is to make a profit. It's an anti-market industry. It's one of the only industries that it makes more money by putting out less of its product. The less things they do for patients, the more money they make. Treats healthcare as a commodity with goals to sell expensive drugs. Emphasis is on specialty procedures and treatment, not prevention and primary care. Now, I'm a family doc, and I'll admit, my wife over there is also a family doc, but we deal in prevention. And did you know that in most countries, they build on a primary care base? It's like a pyramid. The number of doctors in the country, 50% are primary care doctors. Family docs, pediatricians, internal medicine doctors. The next 30% or 40% are specialists. And the top 10% are the super specialists, the ones that only deal with the left eye on a Saturday, something like that. In our country, we have it backwards. We're an inverted pyramid. Primary care is about 30% of the doctors. And then all these specialists on top. And so it's an unstable pyramid, obviously. It's going to topple. And we know that prevention is better than fixing it after it already happens. So here, scrolling through there, this is a graph of life expectancy. See, we're down here at about 78, and all those other countries, Japan's about 85, and we're just ahead, just behind the Czech Republic, Costa Rica, Chile. So all these other countries that have a higher, longer life expectancy than we do in this country. This is my new favorite slide. Okay. Let me explain this. Right. This is 17 countries around the world, including Japan, Norway, Sweden, most European countries, and a few in Asia. Okay. The rank is quality or mortality. Mortality. The age groups are across the bottom. Okay. So these two graphs you're going to see are men and women. Up to age 65, we're in the bottom as far as mortality and life expectancy. Guess what happens at age 65?
Medicaid. You can go up.
What's that?
You get Medicaid.
Everybody gets Medicare.
Medicare.
Guess what? Age 65 happens, and our mortality approaches that of all these other nations. To me, if that's not evidence enough that we need Medicare for everybody, I don't know what is. Love this one. Love it. So the U.S. system is, no one would devise a system like this. I mean, Taiwan, about 20, 30 years ago, devised the healthcare system. And they looked at all the healthcare systems in the world. And did anybody ever read the book by T.R. Reid called Never remember the name of it. What's that? He was a reporter who went to about 12 different nations in the world and went in to see a doctor with a sore shoulder and basically asked questions about the healthcare system. And he basically found out that we don't have a healthcare system. We don't have a system, basically. Every other country, and Taiwan went and looked and asked all these other countries. They took what they wanted from these different countries. And I went and asked them, did you take anything from the US system? No. No, there's no way to build a healthcare system from what they do in America. What do we do best in America as far as healthcare?
Make money.
Make money, and we keep people alive towards the end of their life. We're really good at it. If you're really, really sick and you're dying, we can keep you alive for a long time.
At great cost.
At a lot of cost. The vast majority of the dollars spent on Medicare is spent on hospitalized patients in the last 2 weeks of their life. Because maybe somebody knows somebody, a Medicare patient who's in the hospital for a few weeks, ended up getting sicker and sicker and sicker and died. Or they went to a nursing home or something. And during those 2 weeks, they saw 7 or 8 specialists probably on a ventilator. Probably ran up a bill of close to $500,000 during those 2 weeks. To what end? That's another thing we can debate for a long time. We give great care when people are really sick, but ill and self-protection. Other industrialized nations, like I said, already built on primary care.
Doctor? Another point too, we were talking earlier, you and I were talking up front, it's not just prevention that's being retarded by this policy, but also cures. If you look around the world, there are cures being found in other countries because it's much more economical to not only prevent a disease, but to wipe it out than to just keep treating it and treating it and treating it and treating it.
Yeah, there's a lot of hubris. That's the right word. Not humble. Yes, hubris in this country that we do everything better. People come from flock from all around the world to come to America, and you probably know somebody from Canada who's come over to the U.S. to get a procedure. I don't doubt that. If they have enough money and they want to get it done sooner, they can come over here. If they waited a little while, they'll get it done in Canada too. But if they need it now, they'll get it done in Canada. But we think we do everything better than everybody else in the world. It's just not true. They have scientists. I mean, for what they pay for healthcare in European countries, they still have scientists that are making breakthroughs as much as U.S. scientists. Why do we have the monopoly on that? We have the best. We just don't. So, if I had a dream, stealing that from Dr. King, sorry, what the future holds would be single payer Medicare for all. Now, there's a lot of debate on should we keep using Medicare for all. And one of the reasons is, what are the insurance companies doing with that phrase now?
Socialist. Calling it socialism, socialized medicine.
Also, who has a Medicare Advantage plan? Anybody? Medicare Advantage plans are subsidized by the government through private insurance, right? Yeah. They're saying, yeah, we're all for Medicare for all. If you let all of us companies take care of all the Medicare patients, it'll be better. No way, no way. Medicare Advantage plans tend to take care of the healthiest seniors, and the ones that can afford the really good plans. Seniors that get really sick and don't have an income anymore, guess where they go? They get dumped on traditional Medicare. So Medicare Advantage plans are, it's like smoke and mirrors with insurance companies. They want to sell the idea that Medicare for all includes them. Now, when you hear me say Medicare for all, it has nothing to do with insurance companies. They go away. Now, who feels bad for the insurance companies? Sure.
So right now, Medicare only pays 80%. If I have a problem, then my Advantage kicks in. Does that mean if we had Medicare for all, it only pay 80% to everybody?
No, they pay everything. They pay everything. But I think the reason they've done that they've had to go to the private insurance companies is because they're running out of money. And until we fund a Medicare for all, it just, you look at this room, half of us would have been dead 50 years ago. I don't want to creep you out or anything, but we wouldn't have been living to the age we are now. Now, by 2050, something like 30% of our population is going to be over 75 or something like that. That's going to be a lot of people to take care of. And Medicare, as it's structured right now, just doesn't have the funds to do it. They run out of money. It was a great idea, and we'll show you a little bit later how we should have kept going. So Medicare for all, as I see it, is everybody's in it, no one's out. Simple and efficient. It's the most fiscally responsible. This is what matters to me about the other side. If they actually were honest and said, what would save us the most money, this is what would save us the most money.
The key word to understand is our risk. If you know anything about statistics, you know that the insurance companies are gambling. It's essentially a gamble to buy an insurance policy. And gamble is that they will not have too many people who need it in a short period of time. Right. Consequently, the larger the pool of people in any individual policy, the lower the costs. And the largest possible pool is 320 million. All of us.
There you go.
That's the largest pool.
Yep. That says it very
The
well.
lowest cost.
Yep. It offers incentives for better quality care. One of the other arguments I hear, the socialist argument, I'm going to give you an example about what if we, I want to read it because it's really cool. This is written by a gentleman, a doctor who was the former president of my organization. He said, imagine if we funded public schools the way we funded hospitals. Instead of giving schools a lump sum, global budget to take care of all their students, we required them to issue per student bills that would reflect each student's unique educational needs and the precise mix of services they receive. Assume all the teachers have to issue bills for every episode of instruction, provided to each pupil daily, using a complex fee schedule, incorporating the length, complexity, and intensity of each interaction. Finally, imagine that the tsunami of bills is not just to the local government, but to educational insurance plans with varying rules and requirements. That these insurers frequently contested the charges and that schools were required to collect co-pays and deductibles from parents, which vary depending on how much education the child consumes. And then it goes on to talk about how, yes, there are schools in rich neighborhoods where they'd be able to pay for that, right? What would happen to the kids in the poor neighborhoods? That's what happens with the healthcare system. It's the same thing. And when you talk about socialism, we socialize most services in our society. Fire department, the military, the libraries, the roads. We pay for taxes to get that done by the government, right? Schools, right? Or public schools. So the word socialism, and who knows the Bernie Sanders for just go ahead and say it, the democratic socialism. Like we didn't know that already. But socialism shouldn't be a dirty word. Socialism got a dirty word because of the 1950s. That's where it became a dirty word. And you know who perpetuated that myth more than anybody? I have another article up here you might want to read, written by some med students. The AMA was the American Medical Association, was the biggest culprit in perpetuating that myth about socialism. They put out a video narrated by none other than Ronald Reagan back in the 1960s, talking about how socialized medicine was the road to communism. Put out by the AMA, us doctors. We caused this problem. It's the doctors' fault.
On that same point, I heard you earlier say that most physicians, most doctors, are for Medicare for all.
Mm-hmm.
But if you get right down to it, isn't the AMA an outspoken opponent against?
Well, that's very interesting you should say that. They recently had a Congress in Chicago. A friend of mine is a delegate. And there were some protesters that got up and disrupted proceedings for a couple hours. There were people talking about Medicare for all. When they finally cleared them out of the room and had a vote, yes, a proposal that would acknowledge Medicare for all as a possible solution to our problem was voted on. It was voted down 53% to 47%, which is the closest it's ever been, closest margin ever. But the problem with the AMA is it is also insurance companies and it's politicians.
What percentage of physicians in the United States actually belong to?
I don't know. I don't.
I had heard a statistic that it was less than 30%.
Yeah, probably.
The last I read is 25%.
The other thing that business should do is the bottom of it. Employers would no longer have the burden of saying we have to supply health insurance for our employees. That would be incredibly freeing. Think about how much more competitive they could be with wages around the world.
It could.
They could be, but they would not have that burden anymore. And if they lay off people because they can't pay for the employees. And the number of employees that are giving health insurance, of course, has been shrinking over the past decade. It's not, and we're going to talk a little more about that. So the free market has failed healthcare. If you look at brand drug prices over the past 8 years, 264% inflation compared to general inflation. Now, I don't know about you. So, and the business health insurance bill, this is for businesses paying for their employees. It's up over $1 trillion in 10 years. $1 trillion. It's a lot of billions. So the truth about Medicare for all.
I just looked it up. 25% of the doctors want the AMA.
I'll remember that for tomorrow.
Is there another organization called the American College of Physicians and Surgeons?
Yes.
And they are in favor.
Yes, they are. That was a big one about 5 or 6 years ago, the American College of Physicians, which is mostly internal medicine doctors. They have come out in favor of this, which was a big deal. That's like 100,000 physicians. So patients have a free choice of doctor or hospital. That's the truth. You can go anywhere you want to see a doctor. You can choose, you can have me as your doctor, and you never have to go anywhere else. Period. Because
You're kind of far.
I know. Plus, you want to give me for a few more years. It's social insurance, not socialized medicine. That's where the socialism comes in. Who knows which country has actually socialized medicine? Great Britain. Great Britain has socialized medicine. The government runs the healthcare system. They own the hospitals. They pay the doctors. They pay the nurses. That's not what this would be. This would be, it's a social insurance. It would have one payer that doles out the money to all the hospitals based on a very complicated formula. I don't know what that's going to be. That's to be determined.
The Germans have half and half.
What's that?
The Germans have half and half.
They kind of have half and half, but they cover everything. They don't leave anybody without extra money. And if you get sick and you can't work, it automatically covers. It upholds the original intention of insurance, love thy neighbor. Who knows what the first insurance was? Medical insurance. 1930s, Dallas, Texas, Blue Cross Blue Shield offered the big hospitals in Dallas, we will cover all of the hospitalization bills for all of your employees if they give us $6 a year. Of course, hospitalizations in those days, when you went in the hospital in 1930, you either got better or you died. There wasn't much they could do to save you. So there wasn't a lot of technology.
What about Kaiser? They're
Not that early. So anyway, that was social insurance. That was, and then something happened in the 1940s to change all of that. I don't know what. What was the big thing that happened in the 40s? World War II. World War II came about, and the industry, employers were losing employees left and right. They had to try to entice people to come work for them. So what did the life insurance companies do, Aetna and all those? They offered health insurance to those companies and said, we will, and they got it subsidized by the government. We'll offer health insurance for the employees, and that was an incentive for people to come work for them. And it blew up from there. But their insurance was not social insurance. It was based on risk. So if you had a higher risk, you paid more. No insurance should actually work that way. Just because you smoke and drink or have a lot of health problems, you shouldn't pay more for your insurance. It makes absolutely no sense. Yeah, that's the whole point. Did anybody see the movie back in the early 2000s by Michael Moore called Sicko? Yeah. My favorite line from that movie is they're interviewing a gentleman from Canada who vacations every year down in North Carolina. And they make sure they get insurance with him, and his wife makes sure they get insurance before they go down. So they're well off. So Michael Moore is interviewing, and he asks them the question. So, you pay a lot of taxes for your health care. Why do you think you should pay for these people, that don't work or can't work? And he said, someone needs to take care of them. That's the Canadian spirit, right? We pay lip service to that in our country, but we don't practice it. Because what do you hear whenever we talk about something like this? People don't want to lose their insurance. And they don't realize they have better insurance. Innovation would actually flourish because that's not market driven. 88% of Canadians, when they poll them about 10 years ago, said they would choose their system, not change the U.S. system. And everybody I talked to who's against it knows somebody from Canada who hates their healthcare system.
Oh, especially in this town. We get a constant talk in this town about how Canadians hate their system, but they're not about to give it up.
Right.
And also when they go to have birth, they go over to Canada for birth.
Or to get their medicines. Yeah. Because everybody's going to complain about their health. The French complain about their health system. Of course, they complain about everything. Every country complains about the healthcare system, but if we ask them, would you want an American system? No, thanks. You can keep it. Because they don't know what is. How would you even set up a system? You people over here that aren't working, you don't get health insurance. You people over here that make over $1 million a year, you get the best health insurance. How do you think that would go over in the polls when they try to pass it? It probably pass. Yeah, well, because the lobbyists have a lot of power. Right. How does Canada control costs? They have low administrative costs. They have about half the administrative costs. They have, they have to administer to different provinces in different ways. They dole their money out to the provinces. That's how I understand it. We have a lump sum global budget for hospitals, stringent controls on capital spending for new benefits. Another hard sell for this country is going to be, I work at St. Mary's Hospital in Grand Rapids. Anybody ever been there?
Grand Rapids or St. Mary's?
Grand Rapids, St. Mary's in Grand Rapids.
I have been to Grand Rapids.
Okay. But they built 2 new buildings for hospital rooms over the past 15 years. Every room is a single beautiful private room. Flat screen TV, basically family members can sleep on the couch, pulls out into the bed. In a single payer system, would you be able to spend the money to do that for every hospital? Probably not. And would Americans want to give that up? To have actual health care, I would hope they would consider it. But we're spoiled.
I was a patient at Vietnam just for overnight surgery, and you could order food anytime.
Anything you want.
I ordered food like 4 times. It was great. Wow.
They postponed the surgery.
It was after the surgery. But I didn't know, I worked there, and I didn't know that we offered that.
Yeah, because every hospital is fighting with the other. It's like,
Right.
to me, in in Grand Rapids, there's 3 big hospitals. There's Metro Hospital, which is mostly osteopathic doctors, but they're now partnered with U of M. There's Spectrum Health, which is the big jolly green giant on the hill. They're the big one. They've glommed on to lots of hospitals in Northwest Michigan. And then there's St. Mary's, which is a Trinity Health Hospital. They're all trying to build newer, better buildings. It's like, to me, it's like they're all racing towards a cliff because, eventually there's not going to be enough money for all this stuff. Single buyer purchasing for drug, you need that. But that's one bill that they can pass. Let the government bargain to get drug prices down. I have another family. Well, this wasn't because of cost, but it was a husband and wife that are in their 60s, and they came in to see me the other day, and his blood pressure was a little high, and he said, "Yeah, I've been out of my medicine for 3 months. How come?" Our insurance lapsed. We didn't have coverage for 3 months, so I just didn't take it. This guy has horrible high blood pressure. He was basically playing Russian roulette with his health. And I said, "I wish you'd have called me. You could have gotten me some." But that's what they do because it's prohibitively expensive to buy these drugs. And if it was if I had anything to say about it, they would not advertise any pharmaceuticals on TV. It's a waste of money. Pharmaceutical companies spend twice as much money on marketing than they do on research and development. And they whine and cry. They say, if we have controls on our costs, we won't be able to do any research. You know who funds most of the research? The government.
University of Michigan does most of the research.
Yeah. NIH funds most research for drugs.
But they gotta pay for their lobbyists.
Yeah, they got to pay for the lobbyists. That's the next couple of slides.
I went to the pharmacy
Hey,
and
watch, remember somewhere.
a Narcan prescription to have. And I worked as a nurse for 38 years. Narcan was like 50 cents. They told me it was $300 to get a nasal spray Narcan. Now I got a $200 coupon because I was paying cash. But I was like, what? That's ridiculous.
The biggest crime is inhalers for asthmatics. Many asthmatics go down because they have to pay hundreds of dollars for their inhalers.
Yeah.
That's almost like saying, we'll let you die. In my opinion. It would exclude private insurances, period. Another big thing you hear that, well, there's 1.5 million health insurance or health industry workers in this country. What are all those people going to do if you don't have insurance companies anymore?
Go to work.
I figure these guys that own these insurance companies are pretty smart. They'll figure out something to do that they can sell or they can still have a business. I think the answer would be that if they all became home health care workers, because we are going to need thousands more home health care workers over the next, for that same reason I talked about senior citizens. Most seniors want to stay in their home, right? Everybody agree with that? And so if you could cover home health care, why can't those people that used to punch buttons to prevent me from giving a drug to somebody, why can't they become a home? It wouldn't take that much training. Part of the bill.
Because they make a lot less money and have to do a lot more for them.
Yeah. Well,
Or work.
there is money in the 676 bill to bridge people from the health insurance industry, a certain amount of money to bridge them for a year until they were retrained to do something. So that would be part of any bill that, for single payer. All right, what's okay in Canada? Life expectancy is 2 years longer, infant deaths are 25% lower, universal comprehensive. More physician visits, hospital care, less bureaucracy. The quality of care is equivalent to insured Americans. So, right? It's just good. And doctors in Canada make as much money as I do, or more. Super specialists that in this country make $1 million a year for everyone making $1 million a year. One of the sickest things I saw in the last 10 years was in Grand Rapids. Quick story, telling a lot of stories. Spectrum Hospital was joining with this big cardiology group, West Michigan Heart, and they were negotiating. And the headlines of the Grand Rapids press said, negotiations have broken down because the cardiology group is asking for a guaranteed salary of $750,000 a year, and Spectrum only wants to offer $500,000 a year. I almost threw up. I said, cardiologists should probably make more than me, but not 3 times as much as me. I mean, I do a lot of good things for a lot of patients, and so do they, but they're not worth 3 times as much as I am. I'm sorry. So the grand experiment that happened in 1971, this is kind of another really nice graph. You see back in 1971, the HMO Act was passed in our country. Canada fully implemented their national health plan. Look at the percentage of GDP over the past 45 years. Ours has gone on a straight line up, and theirs flattened out. We were in the same trajectory until then. Another slide that's self-explanatory. It's like a drop in the mic kind of slide. This is the life expectancy gap in Canada since the 70s, the last 4 years. There used to be a 1-year life expectancy gap between us and Canada. Now it's 2.5 years. Medicare Advantage plans have a higher overhead than traditional Medicare. Shows that there. Barriers, powerful corporate entities oppose change. Insurance companies, pharmaceutical firms. The healthcare industry spent $1.4 million per day lobbying members of Congress, 6 lobbyists per member of Congress when they were debating the ACA. Max Baucus, who was the head of the Senate Finance, Senate Finance Committee was the one that came up with the bill. He got $1.5 million for his not even contested race and from the healthcare insurance. And most of his employees went to work for the healthcare insurance after he went out of Congress. This is some pay for some CEOs in healthcare. Again, kind of obscene. So how do we pay for it? This is another one that people get stuck on. Well, left in the red, in billions of dollars would be the new costs that we have with the single payer health care. Medicaid made adjustments. I don't know exactly what that means, but it says that on the slide, so I read it. Okay? Covering the uninsured would cost another $110 billion. And increased utilization. All of a sudden, everybody has insurance. It's going to be a lot more, plus dental and home health would be covered under the bill. So that's going to cost a lot more money. So that adds up to, a lot of money. But what we would say, government administration, $23 billion. Health insurance administration, another $150 billion. Administrative costs to providers. That's what it costs. That's what we would save if I didn't have to fill out a form for every insurance company. And I wouldn't have, I could see 12 patients in a half day because I would bill this. Who do I bill it to? Oh, so it's the same place every time. I think I'm going to cry if that ever happens. And we'll just say, this is so easy. Like I said, I spend a lot of time on the phone calling them, getting somebody to talk to say, why don't you cover this? Can you do this? It's really sickening. So what else would we say? Increased market power because there'd be better prices on drugs and devices. So that's an overall savings of $243 billion. When they say it costs $5 trillion to implement it, that's a bunch of crap.
Even if it did, we couldn't do it if. We could do it.
Yeah.
The problem is when you look at our revenues in this country as a whole, taxes, and about half of them for the last 4 decades have gone to the Pentagon, to more aircraft carriers. And when the economists publicly discuss our budget, they are only talking about half of the budget. Right? They're not talking about the half that the Pentagon gives. So we could afford all of this plus more if we could cut back a few aircraft carriers.
Thank you. I remember that. You remember a lot of what you said. Okay, the truths are government can and must do good to protect its citizens. All of them, not just the privileged. 17%. Everybody wants it. The public is even 60 to 65% in favor of it. Nurses are overwhelmingly in favor of it. Physicians, 59% in the 2009 survey were in favor of it. Unions are really in favor. Now, I wrote this for a talk that I did with physicians, the grand rounds I did last year. Why do physicians care? Because we have prided ourselves in advocating for our patients. Single payer frees us from the restrictions of insurance companies. Because we believe in cost effectiveness and teaching prudent use of resources, and single payer would allow that. Because we espouse the concept that we providers will see any and all patients that come through the door. And single payer is the only system that allows us to do that. The only system. Because our Hippocratic oath mandates that we do good and do no harm. I take that very seriously. The present system makes us stand by and watch while the patients are not being treated because of the wrong insurance. Because regardless of our faith, belief system, or religion you espouse, it's the right thing to do. Here's what the answer to your question, but what kind of physicians are in favor of it? Psychiatrists are the biggest in favor of it. Pediatrics, emergency medicine, general peds, internal medicine, all over 50%. Family medicine. The radiologists, people that get paid for procedures, are not in favor of it. They get paid lots of money for doing procedures. So, and you know, I had open heart surgery 10 years ago. I'm doing great, by the way. Where? In Grand Rapids at Spectrum now. One of those doctors that was making $750,000 a year operated on. He did a good job. I can't argue with them. But, you know, they are against it. Cardiac surgeons, orthopedic surgeons, neurosurgeons. So so that kind of finishes what I have to tell you about. I had some extra notes, but I don't think you can ask questions and talk instead. I have some other literature up here. I have some buttons, some books to show you. But
the chief surgeon here in our hospital is definitely against this. He used to blast it on Facebook and stuff like that. He stopped when one of his students challenged him, Dr. Dobberton, challenged him on Facebook, and is really known to be able to quote some of the same things. Now he isn't saying anything. He's still against it, but at least he shut up.
yeah, I mean, in my opinion, besides these kind of groups, the most important thing you can do is remember 2 or 3 of these facts when you're talking to your neighbors, or if you want to get into a discussion about it. But if they're really don't want to hear it, you know, I get really heated up when people don't want to hear it. But talking to your neighbors, talking to your family, spreading the word amongst the people. That's the most, and it's going to take, I think it's going to take a big movement.
Yes.
And unfortunately, in the internet age, it's hard to get a true movement organized. I think you'd think it would be easier, but there's so many movements out there, and so many people taking people's attention away from things.
People don't come to meetings like this. They sit in front of their computer.
Right. Hopefully, there's about 100 or 200 a month that watch it.
I wish, but there's a few.
Okay. So number 4 is my biggest one. So you can actually join Physicians for National Health Plan. The website is listed on these brochures here. You don't have to be a doctor. And they have an annual meeting every year. This year it's in Philadelphia, the first weekend of November. And
Doctor, actually, so I'm keeping track. I haven't been on my phone the whole time. I'm keeping track of questions online. We just got the question from Susan Puska, who's actually watching from Virginia. She wants to know, what is the cost of America's lack of real healthcare system on infant mortality, the health of our youth, and the next generation in general?
oh, it's going to be, I think the system is actually going to break down and completely fail in the next 10 years or so if we don't do something. I think it's going to cost them, the projections I saw 5 years ago were by the year 2025, the average health insurance bill for a family of 4 will equal their income. So that's what's going to happen. Another thing I saw was, I have another small book that I just got in the mail. It's called Common Sense. It's written by the same gentleman that wrote, he's written about a dozen books, Dr. John Cavacece. And this book is about 30 pages. It has a very brief summary of the arguments against the myths about single-payer healthcare. He talks in here about how it's going to be paid for. And it's paid for by a progressive tax that the wealthy will pay more. And actually, people that make more than $250,000 a year will not save money on this program based on what they pay now. I can accept that. We won't make, we're not going to make money on this. But that most people that need it will benefit greatly. The other sad fact I saw in one of my other meetings was when I talk about health insurance that's supplied by employers, 84%, it covers 60% of our population, 180 million people. The vast majority of the people that benefit, that use their employer-based health insurance, make more than $80,000 a year. 84% of people that make more than $80,000 a year, or roughly that, 400 times the poverty. 84% of them use their employers. When it comes to people that make less than 250% of poverty level, so like $40,000 a year, only 35% use employer-based insurance.
My question is, if this would be paid for by a progressive tax, wouldn't employers benefit by not having to pay for health insurance for their employees?
Oh, yeah.
They wouldn't have to bargain,
No.
they wouldn't have to have it in our union contract, they can still provide dental. And then
Well, dental is part of the program.
That'd be great.
So is mental health.
Mental health,
But why wouldn't most employers, these people who make a lot,
I've been asking myself that question for a while.
why wouldn't they say, hey, yeah, back it up?
The same people who sit on, the same people who sit on the board of control of General Motors, sit on the board of control of the EMA and the pharmaceutical industries. The same people that's overlapping.
They don't benefit.
Yes, they do. They sit on
They're
both
making
boards of
money.
directors. They get benefit. They don't just sit on the board of directors of General Motors. They sit on the board of directors of a dozen different corporations.
I was a physician in the Air Force for 10 years, and my system was a military system. I saw active duty and their families, and I saw retirees and their families. And they'd come to me, and if they needed something, antihypertensive medicine, I'd look at our formulary, and I'd have like 20 to pick from. I'd say, okay, we'll pick this one. They're all cheaper. They say, okay, I'll take that one. And 90% of them, 95% can do with what's on that formulary. They never had a bill. They never had a copay. And I could see, and my charting was very simple. So when I got out,
Socialism.
yeah, it is. It's military.
Well, I've been in the military for 6 years, and the best medical care was the name of doctors.
Yeah.
Don't tell me the government cannot run a great medical.
Any veterans in the room? First Gulf War. Anyway, any other questions? Comments?
Something in your slides, we're talking about healthcare, and people forget that mental health is part of it.
Yes.
This would drastically change mental health, because right now, obviously, we're underfunded, but again, it would focus on prevention. So things like substance abuse would go down. Suicides would go down. Now, those things are hard to quantify because there's all these other factors in those things that can cause those problems. But you're seeing it in other countries because, again, the focus would be on prevention. So we would prevent trauma. We would prevent substance abuse because of that. We would prevent suicides because of that. So there's things here from a mental health. I'm a mental health professional. I work as a clinician in the prison system. What we see every day there, we know we could prevent with this kind of a system. And you literally would even prevent some of those people even being in prison.
Right. If we had this and we had better mental health,
Exactly.
half of the prison
Exactly.
population wouldn't be there.
Exactly.
But that's a whole nother thing, because they don't want the population to go down.
Because it's a big
Well,
number.
again, you have people who are
the biggest
invested
money
in that.
makers in Michigan.
You have people, exactly. I can name the medical people of Horizon, for instance, who I fight with daily. Because they make money on things. They're lowballing something and they're making money on something else, and it's a very nasty system. This would eliminate that.
So we need to talk to our legislators about this constantly. I don't know, I just moved here, so I don't know who the House of Representatives are.
Lee Chatfield is our representative.
Okay.
Chatfield for state.
On the state level.
And,
Yeah, we're doing this waste of time.
Both
They're
political parties
wasting time.
have indicated they do not want single payer. During Obama's first 2 years, he had a Democratic Congress, and we did not get single payer.
Yep, that was his biggest mistake.
Democrats do not want it. When I read history books about Franklin Roosevelt and how he changed this country for the better with things like Social Security, he did not do it out of the goodness of his heart because he didn't really believe in it. He did it because people rose up and demanded it. The communists in this country rose up, the socialists rose up, and the union people rose up against the government. And Roosevelt did it to save the government. He didn't do it because he wanted it. That has to happen again. We don't have the communists to help us this time.
Basically,
They're working on it.
don't try to get your politicians to change your politicians.
Right, absolutely. Is that right? I don't know. We tried.
Another unfortunate byproduct of this is that another myth out there is, well, it's not necessarily a myth, but a single payer system would cover abortion services. And right there, you turn off 10-20% of the population. They won't even consider it because of that.
Well, if you want me just to comment again, Roosevelt was planning on originally, he went to the 20th Century Fund and asked them how to do it. They are the people who designed Social Security. Now they call themselves the Century Fund, but back then they called themselves the 20th Century Fund. And
what was it like back in those days?
I was there, but I read Roosevelt and the 20th Century Fund were thinking about single payer for everybody, but the reason they did not, because they understood that none of the white people in the South would share facilities. That's racism raised its ugly head.
This organization has meetings every year. 2 years ago, it was in Atlanta, Georgia. And we marched on Grady Hospital, which is the one county hospital in Atlanta, Georgia. They, for decades, used to be the only hospital that African Americans could go to. So we demonstrated on the steps of Grady Hospital. It was really cool. If you look, you can see me in a video on the website.
A lot has changed though since then, hasn't it? I mean, I think it's a bit more liberal now.
How's the mall doing?
I have a crazy thing going on right now that's right in the middle of all this stuff. I just was prescribed hearing aids, and I have extreme hearing loss on my left side. So I really need them. Okay, I have Medicare, but I have Plan B Blue Cross, and I had, in order for Blue Cross to pay for the hearing aids, with $2,500 makes it worth the trouble. I have to go to my regular physician and at an appointment that he bills for, so that he can say that I'm medically okay to wear hearing aids. And otherwise, they won't go ahead and proceed and pay for the hearing aid. And I just saw this doctor for a med check in the beginning of May. So
Gotta make sure you're not stuffed up with wax. That's your only problem, you know?
yeah, but it's just, the audiologist didn't look, but what the heck?
Yeah, the specialist doesn't know.
These are from Costco.
Oh, really?
You have a Costco up here?
No.
Costco, $1,500.
Oh.
They're really good. I had them from one of the more expensive places in Grand Rapids for $2,300. And one of my patients told me, go to Costco, it's a lot cheaper. So I took the ones back to the other place, went to Costco.
Oh, okay.
$700 cheaper.
Are you a member?
Yeah, but will your insurance pay for it?
No, I didn't even try.
Oh, okay. I'm going, thank you.
But I get a lot of discounts at Costco.
Our closest Costco is Traverse City.
Oh,
I think there's a Facebook page if anyone's interested. It's called Bring Costco to the
they're a remarkable place. It's kind of scary in a lot of ways, but it's pretty remarkable. I mean, we vowed we'd never go to one of those places, but when I got this deal, I said, oh, why not? You know?
Well, they do fair, fair wages. They have insurance for their employees.
And you can get, there's another, you don't know about, anybody heard of the website GoodRx? If you want coupons for some of your meds, you can go to the website goodrx.com and you can get big time discounts at pharmacies, different pharmacies. I've used it, I've given coupons to my patients for medications.
Does that count against the copay?
Hmm?
And does that count against the copay? That makes your copay less because the drug is less.
Yeah, I mean, sometimes it's remarkable. It's like, half price or whatever.
I'm also gonna say it depends on the insurance company.
Yep.
If you find one that I consider what I'll call a little bit stupider, because I take really expensive medicine, so the drug company pays for it, most of it. You pay like $5, but one of my insurance companies that I had decided that I paid the whole $7,000 for that month. So they took that off my max out of pocket instead of the $5 I paid. So, shop around.
Oh, there's just another question online. I'm just going to read this whole piece. It says, this is from Larry Gates. It says, we should also be asking why are our legislators letting the corn, sugar, and sodium industry being allowed to cause some of America's health problems, such as heart disease, diabetes, and obesity? Is fighting obesity covered under any insurance plan?
Yes. I mean, we do charge for and document obesity as a disease, as a diagnosis. So if you do that, then it should be covered in a visit. If we have high blood pressure, diabetes, and obesity, and we can say that that's a problem, we can bill at a higher level. And yeah, it can.
Would Medicare for All, for example, or would a single payer system help with some of that?
Oh, yeah, I mean, because it would focus more. One of the other big problems I didn't talk about is how are we going to get a workforce of family docs? Because medical students aren't flocking to family medicine because their student debt is so big. They figure, and I tell them, hey, you'll be making $200,000 within a couple of years. You'll be able to pay off your debt, okay? And but they think it's too hard, or they think it's they want to do something. But I tell them it's not really harder. It's more challenging than just about any other kind of medicine because it's more interesting.
Work in a rural area and get forgiveness.
Yeah, exactly.
Get you.
I mean, how many towns in the UP could use a doctor?
We don't have a psychiatrist anywhere north of Cambridge.
No,
Not one.
not even for the VA place.
Nothing. Everything is using telemed. We use telemed to see psychiatrists.
That's not what's killing people. The kinds of things that those specialists do are not the kinds of things that reduce mortality significantly in society at all. The single most important thing that determines mortality in any society is diet. And as far as medicine goes, it's simple things like influenza. That's what accounts for mortality more than anything else. Still to this day, and malaria. Still the two biggest killers in the world. And that doesn't involve specialists, it involves physicians like you.
When I heard statistics like that, it wasn't actually medical care. It's actually education.
Yes.
Education. Just education in general is the biggest driver of poverty and of poor health.
That's something. You said education as far as poor health. 3 years ago, I was diagnosed as having very high blood sugar, so I was entering into being diabetic. I have a very progressive doctor who actually listens to me and lets me help educate myself. I beat that with diet and exercise. I'm not on any medications. I check my blood sugar every day. My AC1 or AC3 is like 6.1. It was 13.
13 and 6.1, congratulations.
Point being, I mean, that's the problem okay, I'm just gonna accept the doctor says, he's gonna put me on a med, yada, yada. And no offense to any doctors, but you know what? Go educate yourself. Go read up. Go get in the user groups online and find out that, you know what, weightlifting is one of the best things you can do to drop your blood sugar.
But the company that sells metformin, gives me these dinners like once a month. So why would I give those up? Just kidding. I don't do any of those.
Yeah, I'm sure you don't.
Another question.
I just have a question. I actually have a lot of experience with student debt, and with I actually went to law school, and my student debt would make most doctors go, "Wow, that's similar." The question that one of the things that they have for law students is if you work in public service for 10 years,
Right.
you can get that debt forgiven. Do medical students have that same?
They have some. Like my son's in medical school at Wayne State.
Okay.
He joined the Army.
Okay.
He's going to have an Army commitment for 5, 6, or 7 years. He'll be an Army doctor, but he will have no debt.
No debt. Okay.
And plus, he gets paid a stipend every month.
I have a question too. In other countries, they have like a single payer type system, right?
Mhm.
Is there evidence, or is it worth looking at, that the government is paying for everyone's health care? Would that then in turn make them more responsible or more responsive to the industries that might be poisoning the air, hurting their water, causing health issues?
I don't know.
I
would hope
to
so.
me like there would be a financial incentive to
Yeah.
police that more rather than.
Of course, in France, who's considered to have best healthcare system by a lot of people, they cover. You get a card, you can go anywhere in the country, and what was I trying to say? I don't know, but they've always had a high incidence of smokers and drink, but they're also, I think, their obesity rate isn't as bad as ours. Plus, they just have access to healthcare. Plus, they get time to convalesce if they have surgery or they have a baby. They can take as much time as they want off. Now, that's causing some problems with their budget, obviously. France has got issues. Say they don't. Every country that has a healthcare system has big issues with it. England is trying to privatize. Canada is trying to privatize more and more. They're getting more and more pressure to privatize. I don't think it'll ever happen completely in Canada, but there's problems everywhere. But at least it's transparent. That's the other point that they make in one of the books, is that if you change it, basically when you're paying insurance companies premiums, you're paying taxes, but you don't know where those taxes go at all. You have no idea. Where in a single payer system, it's transparent where the money goes to. And everybody pays in for one system.
That's why Roosevelt created the FICA, because he knew that if he tried to pay for Social Security with the general fund in the future, some politician would simply take that money and do something else. So he created a separate tax system for that very reason.
Can I ask you also to address another thing that comes up in our neck of the woods? There are some scare reports about, well, if Medicare for All passes, rural communities are going to lose their hospitals and this kind of thing.
That is
How much of that is just fear-based?
It's fear mongering, but
Right.
it would, again, when you put everything in a central budget, you have to make decisions on where the money goes. And they're not going to cut off their leg by just getting rid of delivery systems. I can't believe they would do that.
Well, it wouldn't matter. Our hospital's bankrupt anyway.
Yeah.
Seriously, I mean, our hospital is
I
on
think
the brink,
that
so.
the reason why, and that's why I say I think it's fear-mongering, or like you said, because a lot of them are closing, and we don't even have Medicare for All in effect. So whatever the issues are, it's not Medicare for All that's causing the problem. It's much more.
Another scary thing I just read, though, was that the American Association of Health Insurance Plans or companies, 1/4 of them now partner with health delivery systems. So the insurers are becoming partners with the hospital corporations and delivering healthcare. That's conflict of interest to me. That's big time conflict of interest. And the more they get set into that, it's going to be harder to get rid of them.
Capitalist systems, combinations, constantly hand that over.
I would like to sit and talk to you for 2 hours.
Thank you, Father.
Welcome to Dr. Dauber.
What did you teach? What did you teach?
My wife and I taught sociology here for almost 4
Yep.
decades.
And they had some pretty good students from what I hear.
Yes, you're one of them. You and Phil are the two best that ever went through this school.
Wow.
With,
Right here. There you go.
we have the two finest students that ever went through this school right here in this room. Really.
Well, I don't know about you, but that did hard. Thanks.
Well, I appreciate all everybody's comments. Anybody else? Any other? Well, thank you very much.
Oh, would you be willing to come back and speak to us at a later time?
Sure. And it's only a 300-mile drive. Yeah,
In the summer, you don't want to come.
I was thinking,
don't come back.
I was thinking when the students.
Put me down for January 15th.
January 15th?
All right. I think it'd be an excellent thing to have.
Gas and motel.
Yeah, I was gonna say, I think it'd be an excellent thing to have in the fall when you could have students and.
Yeah, it'd be nice to have students.
Because quite frankly, your nursing students and your sociology students and your psych students should be sitting in here listening to them.
One bit of encouragement is I teach medical students at MSU, and I teach a health policy course once a year. And they get a little bit of my bias coming through when we talk about health policy. And majority of medical students are forcing care. Majority of medical students. I know. I mean,
But they're the new.
I do have hope for
They're younger.
the
they know
younger
what's
generation.
going on.
They think more globally.
More idealistic.
Absolutely.
I had a brother-in-law who got out of training as an anesthesiologist. And
Can't have a health.
First year, 3 years later, he had $900. No good. No good way to do it.
Nope. Dermatologists that charge, $50 every time they freeze it up. Well, they freeze off 10 every time you come in for 5 minutes. That's not good use of resources. Thank you for sitting and listening. Really good. I want you to go tell all your classmates what you learned. Oh, well, when you do, you tell them what you learned, okay?
Excuse me, you have a little book that you said,
Oh, this one.
yes. Is that?
You can get it online. It's online on Amazon.
Yeah, great. Thank you very much.
I have one more question.
Sure.
It's perhaps a question for you, but
I don't
said in 10 years you think the system will fail. Do you have a clear-cut objective criteria for determining when that is? Or are you
There's going to be degrees, and it's going to, the logical other end point for this is going to be a complete two-tier system. You're going to have everybody that is in the lower to middle classes that get very basic services, and the people that have a lot of money. That's what I think might happen. Would you have predicted this 40 years ago?
No. Although,
Probably good that you didn't.
Chomsky was saying things like this 40 years ago, and he almost went to prison.
You ever heard of Uwe Reinhardt? He has a quote that I have. He says it's not a matter of single payer, it's a matter of soul. Our country needs to get a soul. Thank you very much.
You have a question about sugar and salt?
I think it's interesting. Slow.